I've always enjoyed finding out new things. I've also always enjoyed building things. I think that they kind of go hand in hand. The long-term goal of doing the research is to impact patient lives. Our overarching mission has been to discover new pathways that are linked to cardiac disease. We look for chemical signatures in the blood in patients that will predict the future development of disease. We have large collections of samples where patients have been followed long-term and see who went on and developed a heart attack, stroke, or died, and who didn't. And then look back and say, at the time that the sample was collected years earlier, were there chemical signatures there that predict the future events? And if you see that once, then we try to replicate it not only in US cohort, but in European cohort. And then once we get a signal that seems to be reproducible, then we perform basic science studies to see is there a causal link to that association. And that's what's led to the discoveries as divergent as gut microbes being linked to heart disease, to artificial sweeteners to heart disease, to vitamin B3, or a metabolite that's formed from excess niacin is associated with future risk of heart disease. I've actually been working with the folks at Innovation for the past 25 years. It's really an important step for someone who is early on trying to identify something that will change patient care to work hand in hand with the innovation team. There's a business sense to it, and they help be a team member in developing that. Drug development takes a long time. I can see how there's at least another 10-year road in front before some of these things are going to get into even first-in-man approaches. It is all about persistence. It really does take a village, and it includes not just the physicians and the nurses, but also all the research technologists, laboratorians. The whole infrastructure team is necessary. The whole philosophy of the Cleveland Clinic to try to be innovative is what we're known for.